It was 1 month ago that George Floyd died at the hands of Minneapolis police officers. His death prompting massive protests in New York City and around the country. Some doctors warned a spike in coronavirus cases could follow, but that didn't really happen, and we wanted to know why. Here's 7 on Your Side investigative reporter Danielle Lee.
Outrage over the killing of George Floyd brought thousands of people together in daily demonstrations that lasted over a week. Doctors and public officials pleaded with people to stay home and described the demonstrations as a potential super spreading event.
How many super spreaders?
We don't want people out there where they might catch this disease or spread this disease.
So what happened? We tracked daily new positive cases throughout New York City, and we didn't see any super spreading. There were some days with increases just after the protest began on May 29th, June 1st, June 8th, June 12th, June 15th, and June 16th. But generally, the number of new cases kept trending down to just 10 new cases on Tuesday, a 98% decrease since May 28th. The National Bureau of Economic Research also looked at protests and infection rates in major cities around the country, and they found protests did not have a major impact on the spread of COVID-19 in the entire population. We reached out to emergency room Dr. Jijo Joseph to help us understand what we were seeing.
The evidence is showing us that outdoor spaces and wearing masks is effective. And studies out of Italy are showing us that indoor spaces are what's causing transmission of the disease.
In other words, when it comes to COVID-19, doctors are finding that as long as masks are involved outdoors, the concern is a lot less. Line, that those protests probably weren't the health threat public officials worried they would be.
Miguel Marquez, who's live for us in St. Paul, Minnesota. And Miguel, you're at a protest at the state capitol building. Tell us more.
We were here last night. There were about 200 or 300 protesters, and I got to tell you, we are in a 5 minutes of silence right now. I'm going to show you. Take this off. I'm going to show you how big this crowd is. It is absolutely massive. Thousands and thousands of people have showed up. If the president thought his photo op yesterday was going to have an effect, this is the result.
What you're looking at is the origins of a likely superspreader event. At least 8 people, including President Donald Trump himself, are now infected, and that is among those who have had the ability to actually get tested.
You can't see the virus, but what is happening during a superspreading event?
You know, it's a very rough analogy, but if we think of a campfire and say that that's a person who is infected and releasing virus, it's not like it's the ring around the person that is actually going to be the risk. It's those that are on the side where more of the virus is being projected, either through talking or through the breeze, the air that's blowing it there.
But it was also these moments that caught CNN medical analyst Aaron Bromage's eye.
When the event finished, when they were all coming up and hugging and shaking hands and saying congratulations, that's where, if I was a betting person, I would be putting my money on of where this occurred.
We know that the safety protocol for the event was to test anyone in close proximity to the president. But it wasn't required for everyone attending the ceremony. And it clearly wasn't foolproof. Again, take a look here, where the people who were diagnosed as positive were sitting, not next to each other, which leads us to again look at what happened right before and right after. Former White House counselor Kellyanne Conway closely leaning in to speak with Attorney General William Barr. Lots of people closely interacting with their guard down. It can be difficult to pinpoint these super spreader events. This one ceremony, though, is giving us a look at the anatomy of how it happens all the time. Not just here, but anytime.
Every time you start to bring people in from the outside, you're increasing the chances that there's going to be somebody there who has COVID.
But just how much will it increase the chances? UCSF epidemiologist Dr. George Rutherford explained the math based on California's positivity rate, which is about 5% right now.
That means if you pick someone at random to spend Thanksgiving with, there'd be a 5% chance that that one person was infected.
So if you have a gathering with 3 total people, it increases to a 9.5% chance. 6 people from mixed households, there's a 22% chance that someone is infected. With 12 people, you're looking at a 43% chance that someone at your party has COVID. Is there any number of people that you can gather with inside that would be safe?
No, the safest way to have Thanksgiving is to just have it within your own household.
Positivity rates vary by state and county, which means staying local is that much more important. Since San Francisco, for example, is 1.8%, but Fresno County is 7%, and San Bernardino County is 10.5%.
You have relatives in Los Angeles, relatives in San Jose, relatives in the city. Everybody stay where they are. We especially don't want people coming in from highly endemic areas.
There's a recent analogous warning from our neighbors to the north who celebrated Thanksgiving in mid-October.
If you look what happened after Canadian Thanksgiving, the cases were going up like this, but then after Canadians Thanksgiving, the slope changed and it went up very rapidly.
That's cause for concern because if Thanksgiving gatherings cause a sharp spike in COVID outbreaks, it's likely hospitals will fill up and death rates will increase, not just for COVID patients, but other emergencies like someone having a heart attack who might not get help as fast with an overburdened medical system.